Hi, I'm Dr. Mark Faber. I practice child and adult psychiatry in Upper Montclair, and I'm going to discuss positive behavioral support primarily for children up through, for sure, middle school. And in this instance, I'm very often asked by parents, what strategies may help my child? And then I'll talk about what we term positive behavioral support. And very often they'll say, I've tried that, it didn't quite work out. So I'm going to try to explain it in general terms, and hopefully some of these ideas can work. The general rule of thumb I consider is if a behavior-based strategy has not helped, it may not be that that's the wrong approach, but rather we need to modify the strategy itself. So with positive behavioral support, we're identifying target behaviors of concern. And these may be very specific. It could be tone of voice, it could be angry outbursts, it could be non-compliance. And then what we want to do is take those specific behaviors of concern and collect data in regard to them. What are the triggers of such behaviors? How often do they occur? So frequency, duration, intensity. Once we have that information, we then want to flip the negative behaviors or reframe them into positive behaviors. So it might be, using proper tone of voice. It might be keeping calm. It might be, getting your backpack together or completing all of your homework. And then we want kids to earn for desired behavior rather than being punished for behaviors of concern. And one way to do this is to look at a typical school day. And the intervals during which we're looking for appropriate behavior, let's say at home, include before school, after school but before dinner, and then after dinner before bed. So these are relating to home-based behaviors and home-based interventions. And the child can then earn, whether it's points, pennies, tokens, during those 3 time intervals of the day, and there can be 2 or 3 desired behaviors that occur. So in the morning, waking up on time, getting back together, brushing teeth, having breakfast, all of that is done, so you could earn maybe 1, 2, or 3 of these tokens. After school, it would likely be completing homework or starting homework. It might be cooperating or interacting properly with a parent or a caregiver, proper tone of voice, keeping calm. And then after dinner, similar behaviors. Then the child gets to earn during each interval, and then this is reinforced. And in the beginning, it may be reinforced the same day with a favorite, maybe, activity. Or as the child or middle schooler gets better with this, then it may be reinforced at the end of the week. And it doesn't have to be something you buy. It could be just going to a place where, it's kind of neat to go there and interact, or just giving the child some specific parent time. So this is the concept of positive behavioral support. It's very important, it's very effective, and it reframes the whole concept of behavior-based strategies at home. Thank you.